Retrograde left renal venography fails to demonstrate the portion of the renal vein connecting the kidney to the cava. And the reason is the presence of a valve indicated by the arrow. Valves in the renal vein may simulate a filling defect, such as renal vein thrombosis. Valves in the renal veins are distinguished from other types of filling defect because of the smoothness of the unopacified blood in the proximal part of the left renal vein, as indicated by the arrow. Note the retrograde filling of a left gonadal vein. In this patient, we see a smooth tapering of the contrast in the portion of the renal vein connected to the kidney. This is not indicative of a tumor encasing the renal vein. It was simple streaming of a contrast which did not fill the lumen of the left renal vein due to the presence of a valve. These are valves in the left renal vein in a portion close to the kidney. Note the smooth outline of the valve. Observe valves as indicated by the two arrows in the left renal vein. Note the large channel that is directed caudally and to the right, most likely representing a circumaortic venous ring. Note the sharp filling defects indicated by the arrows, which represent the valves in the right renal vein. Other examples of valves are indicated by the arrows. Note the sharp filling defect with densities that vary proximal and distal to the valve. Rarely we may see valves in branches of the right renal vein, as indicated by the arrow in this case. Sonographic examination of the renal veins may reveal echogenic areas that represent the valves, as seen in these two cases. Note the echogenic area in the lumen of the left renal vein that represents a valve.